Hi, today's Sunday the 29th of March. When I last posted a video, there were approximately 18,000 confirmed cases in Manhattan. Right now, the number on the Hopkins website is 31,000. This is the tip of the iceberg. What's important is that there is a doubling every 4 days in Manhattan, where we have been hit with a sucker punch in New York. The issue really now is, how do we separate people who are COVID positive and COVID potential from their home environment and minimize the risk to the elderly patients living in their homes? It was obvious in the beginning that I was hoping to be able to get the state or the federal authorities to donate money to this project. What has become obvious is that there's no money right now. What is also happening is that the state has turned two State University of New York facilities, one in Nassau County, one in Suffolk County, into pop-up hospitals using their dormitories. That is a good solution. There's just not enough beds. So if we look at the run rate of new cases, we're going to need another 10,000 beds in New York City before very long. That then will force us to look at hotels. And when I last spoke to somebody in the hotel industry, there were approximately 10,000 hotel beds that are in buildings that have been shuttered due to this crisis. It is important that we open that up as quickly as possible. I believe that in time, it's most likely going to be mandated. In order to work out what the cost of this is and how to actually facilitate this, I looked at a hotel that has 60 rooms adjacent to our hospital. There is one occupant there at the moment, so I am busy negotiating for a monthly rate to take over this hotel and provide a pop-up hospital facility for COVID positive walking wounded. These are people who do not need to be in the hospital and who do not need to be on ventilators. But very soon, those people will need to be in a facility that will function as a hospital, that has beds, that has separate bathrooms, that behaves like a hospital, and a hotel is the obvious place to do that. So I've been looking to set up a sub-fund of our foundation to ask grateful patients to contribute to this fund so that we can immediately release that money and take over a hotel, thereby underwriting the hotel owners the initial money to provide rooms to us. And if this experiment works, then obviously it is a template for the future. But as I said before, it is very likely, given the escalation and the run rate of infection, that the government, in terms of the New York legislature, will mandate hotels to turn over their buildings to become pop-up hospitals.